From the U.S. Virgin Islands, Ms. Plaskett for 5 minutes.
Thank you, Mr. Chairman, for this hearing. Thank you for the ability to question the witnesses. I find it so interesting and specious that one of the witnesses say that we should take advice from Donald Trump, who before coming to the presidency was a failed businessman, who had companies that went bankrupt. That's who we're supposed to take business advice from? The most recent hearings have shown that not only is he a failed businessman, but he's a con artist who created a slush fund off of the backs of American people through his attempt to overthrow our government through January 6th. So will I take advice from someone like that? I think not. And I think our country is better off without having him as the leader of our country at this point. We've had a lot of discussions about child tax credit and the American Rescue Plan and what it has or has not done. For people living in families living in the U.S. Virgin Islands, by extending the child tax credit to the territories and providing that funding, there has been an enormous uplifting of children that are living in poverty. Ms. Parrott, would you explain to us how the Medicaid provisions in the reconciliation bill passed by the House Democrats in November of 2021 would improve access to healthcare and equity for low-income Americans living in the territories?
Yes, thanks you for your question. This issue doesn't always get the attention that it deserves. The Medicaid provisions in the 2021 House Reconciliation Bill ensures that people in U.S. territories can continue to get the health care they need by increasing Medicaid funding to the territories, which, unlike states, receive capped federal funding for Medicaid that can and sometimes does run out. The bill passed by the House included a permanent increase to the block grants, as well as an increase in the federal government's share of Medicaid funding for the territories. Now, I want to be clear, the bill did not provide full parity with state Medicaid programs because it would continue to provide annual allotments of federal funds rather than the kind of open-ended funding stream that states receive to meet their residents' health care. Ultimately, parity is what people in the territories need and deserve. But the amount of the House-passed allotments, along with the realistic growth factor based on actual Medicaid costs and the increase in the federal government's share of their Medicaid costs, would provide the stable and adequate funding the territories need to bring them closer to what states provide by increasing eligibility, benefits, and provider payments. This is a key core equity issue, and I thank you for the question.
Thank you. We're talking about children. We also, of course, have to then talk about working parents. One of my colleagues talked about not being able to go to restaurants. But we know for many working families, the ability to have proper childcare is still not there. The pandemic has affected childcare, has affected those children who are not vaccinated, who families do not feel safe bringing them or do not have the support for them to go back to work. Not all of us have had the luxury of working from home. Many of us have had to go to work in some instances and had to find childcare. Childcare providers were also hit very hard. Many closed or could not keep talented staff who are struggling through the pandemic as well. Again, Ms. Parrott, how has the Child Care and Development Block Grant help working parents afford their childcare?
So the Child Care and Development Block Grant, which sometimes we wrongly shorthand as CCDBG, which is hard to say and remember, provides funding to states that allows them to provide subsidies to parents with low earnings to cover the cost of childcare. And it also does a lot to actually improve the quality of childcare for all children. CCDBG provides critical but underfunded support to state childcare programs, and most families eligible for childcare assistance don't get it because of inadequate resources. During the pandemic, as you mentioned, many childcare providers closed or reduced their capacity. And when parents were ready to come back to work, many couldn't find childcare or they couldn't afford it. When families can't access quality, affordable childcare, they're left with really quite terrible choices. Stop working or reduce hours, which is often impossible to do and make ends meet, or use more informal, lower quality care. The American Rescue Plan provided $39 billion in additional childcare funding, including funding for CCDBG, as well as funding for stabilization grants. This was incredibly important. It helped shore up the childcare providers, it helped people stay in business or expand capacity. It also expanded help to families, raising eligibility thresholds, reducing copays, and also increased compensation for childcare workers, who I think, along with those municipal workers that Mayor Williams talked about, are true heroes of this time period.
I've run out of time, but if my colleagues, who I understand are so concerned with the life of a child, let's make sure that we do that throughout the child's life, even after they're born. And I yield back.